Have you ever felt like the world is against you, or that a persistent sadness looms over you without any apparent reason? Is there a concrete cause for this feeling? And if so, can it be controlled? Is it merely a mood or something more serious? We explore the answers to these questions and understand. Today, we are going to talk about a very important and sensitive topic called Major Depressive Disorder, MDD. This is a condition that can deeply affect anyone's life. Let's take a look at its main points. First, we will see what it is, how many types are there, what are its symptoms, what causes it, how can it be prevented, how is it diagnosed, how can it be treated, and finally, its conclusion. First, let's understand what Major Depressive Disorder, MDD, is. Major Depressive Disorder, MDD, also known simply as depression, is a mental health disorder characterized by a persistent feeling of sadness and loss of interest in activities. It affects how a person feels, thinks, and handles daily activities. To be diagnosed with MDD, these symptoms must be present for at least 2 weeks. I hope now you have a bit of an idea about Major Depressive Disorder, MDD. Now, let's move on to the next point where we will learn about its types. Let's see how many types there are, friends, although there are many types of depression. Here we are going to discuss some specific points, starting with single episode, when there is only one episode of depression in a lifetime. Next, recurrent, when episodes of depression recur over time. Next, with seasonal pattern. In some people, the pattern of depression occurs according to the season, like feeling more sadness in winter. These were some of the main types. Now let's move forward and learn about its symptoms. Just as there are many types, there are also many symptoms, but here we will look at some common symptoms. So, let's start with the constant sadness, feeling sad or hopeless most of the time. Next, lack of interest, not finding interest in things that were once enjoyable. Next, change in sleep, sleeping too much or too little. Next, lack of energy, feeling tired all the time without doing much. Next, low self-esteem, blaming oneself or not seeing one's own value. Next, decision-making, inability to make decisions over even the smallest things. Friends, these are some common symptoms. Now let's move forward to where we will learn what causes it. Friends, there are many reasons for Major Depressive Disorder, MDD. Here we are telling you about some common reasons found in many people, starting with genetics, if there's a history of depression in the family. Next, brain chemistry, imbalance of certain chemicals in the brain. Next, life events, major life events, such as failure in love, job loss, or the death of a loved one. Next, medical conditions. Some medical conditions can also lead to depression. These were some common reasons often found in people. Now let's move to the next points where we will learn how it can be prevented. Some steps are taken to prevent Major Depressive Disorder, MDD, such as active lifestyle, adopting an active lifestyle and exercise. Next, healthy diet, taking a balanced diet. Next, social support, spending time with friends and family, sharing one's feelings with them. Next, stress management, practicing yoga or meditation to reduce stress. By following these steps, you can prevent bipolar disorder. Now let's look at the next points and understand how its diagnosis is done. There are specific ways to diagnose it, such as self-report questionnaires used by clinicians to help understand intensity of symptoms. Next, clinical interview, meeting with a psychiatrist or psychologist. Next, physical examination, to rule out any other medical condition. Friends, these are the ways to diagnose it. Now let's move to the main points, where we will see how it is treated. Friends, the treatment of Major Depressive Disorder, MDD, is done through a mental health psychiatrist. So, let's see. Medication. Antidepressants that help improve mood. Next, psychotherapy. Talk therapy, which can make you feel better. Next, lifestyle changes. Making improvements in daily routine like regular exercise, healthy eating. Next, support groups, where you can share your feelings and learn from others. These are important points through which Major Depressive Disorder, MDD, is treated. I hope this video will prove very helpful for you. Let's look at its conclusion. Friends, understanding Major Depressive Disorder and getting the right treatment is very important. If you or someone you know shows such symptoms, do not hesitate. Seek professional help. Remember, you are not alone and treatment is possible. Friends, I hope this video was insightful and provided you with good information about major depressive disorder. If you feel any points are missing in this video, please let us know in the comment box and share your strategies. Your health and peace of mind are important to us. Thank you, take care of yourself, and keep learning.